and today we're going to chat to Alice Satwick from Nazing, who is raising awareness of a condition that her son Tommy has. She joins me alongside Professor Martin Snead, who is a consultant ophthalmic and vitreoretinal surgeon at Addenbrookes Hospital. I'm not sure I pronounced that correctly. Alice and Martin, hi to both of you.
Hello.
Hi.
Good afternoon.
Hi. Alice, tell me about Tommy first off. What's the condition that he has?
So basically, Tommy was born with something called Stickler syndrome, and it's a genetic condition affecting connective tissue. Essentially, it's the collagen in our bodies, and it just presents with various symptoms, unbeknown to us, that we didn't actually know that when I went into hospital to deliver my twins, that he actually had it.
So it's interesting that he was a twin, but one twin had and one twin didn't.
Yeah, absolutely. Yeah. It's not actually hereditary, and in Tommy, it was a genetic mutation. So Tommy has it, and Charlie doesn't. And myself and my husband Chris were tested for it, and we don't have it, and you can't carry it. There's a 50% chance that if you do have it, you will pass it on to your children. But yeah, with Tommy, it was just a genetic mutation.
So how did that manifested in Tommy's early years? When and what impact does it have on his life?
Well, as soon as he was born, the midwife flagged up his small facial features, and he actually, they detected a soft cleft palate. He failed his hearing test, and he was referred for a sight test too. Although he had these gorgeous big blue eyes, that can be a sign of myopia, of being short-sighted. So we saw a geneticist at one of the cleft appointments, and she mentioned sticklers, although we kind of had already known about it, doing some various Googling online. However, the charity Stickler Syndrome UK's website actually now has a diagnosis screening tool, and it does mean that people can go on, answer some yes or no questions, and be pointed in the right direction for a free referral. But because he presented with a number of the characteristics of Stickler Syndrome, we were able to join the dots and get a Stickler Syndrome diagnosis much sooner than others. So this followed, he had glasses and hearing aids, and he had them at just 7 months old. He had his cleft repair at 10 months old, and his final surgery was cryotherapy on his eyes to reduce the risk of detachment, age 3.
And so fighting fit now, and
absolutely. Yeah, he is an absolute trooper. I mean, anyone that meets him comments on his character. He's an old soul. It's like he's been here before. But what people really don't see is the invisible struggles that he deals with daily. I mean, he's a great advocate for himself. He will always ask if he needs something, if his batteries and his hearing aids need changing. He's adapted so well to the challenges. He wears prescription goggles for swimming. He wears contact lenses now for jiu-jitsu. He's just got his grey belt in jiu-jitsu. He's so proud. So he's just really adapting, and his hypermobility, because one of the characteristics is being hypermobile. So when we were first on this journey, we were like, is he going to be able to ride a bike? Is he going to be able to do this? And although he can do all of those things, his body is working so much harder than his peers. So he gets tired quickly. And but since the cryotherapy, and although the risk of detachment hasn't completely gone, it's much lower. So he can just enjoy being a 7-year-old with his twin brother and his sister, and just live life to the full.
Fantastic to hear that. Alice, stay there. I just want to come back with you. Obviously, you had a bit of a fight with the diagnosis and that sort of thing. Let's bring in Professor Martin Snead from Addenbrookes Hospital. And this is, I guess, Stickler syndrome, something a lot of people are hearing for the first time, Martin. So I guess this is something that, people in Alice's position, they do have a bit of a battle trying to find the right diagnosis. Is it a tricky thing to work with in terms of diagnosing?
It is, and one of the reasons for that is because it can affect patients in many different ways. You've already heard from Alice: cleft palate, deafness, eyesight problems, joint problems. So patients might present to a variety of different healthcare clinicians who may be less familiar with the condition. I mean, from our perspective, the key point about this condition is it's the most common cause of retinal detachment in children. And whilst we can repair retinal detachment most of the time, adults would tend to present promptly, having reported vision loss. Children don't report the fact that they've gone blind in one eye. And so if the diagnosis has not been made, they often present to us when it's too late to salvage good vision. So diagnosis and prevention is absolutely key.
So it's important to get it right. What do you hope comes from people like Alice, raising awareness of the condition?
It's hugely helpful, and especially the National Patient Support Group, Stickler Syndrome UK. If you just Google that, as Alice has said, they've got a checklist on there which healthcare professions or even patients and parents can look at themselves and give a score out of 10. And it helps to raise the possibility of considering at least a diagnosis. And our national service commissioned by the NHS is there to help make the diagnosis and also rule it out. So it's free at point of care, doesn't cost the GPs or the local hospital anything. And so I'd encourage people to visit the Charity Patient website.
And Alice, you're obviously hopeful that, by talking about it, raising awareness and making the medical profession more aware of it, that it won't be so difficult for the next person who presents with Stickler syndrome.
Absolutely. It's really just about joining the dots, looking at the characteristics of Stickler syndrome and pointing people in the right direction. And like for parents, don't give up if you think something's wrong. You might present with one of the characteristics, 2, 3, but just raising awareness and just making sure that everyone knows that they can have that referral.
Oh, well, lots of love to Tommy. Thanks for coming on, Martin. Thank you, Alice. Alice, just finally before you go, I mean, that grey belt at jiu-jitsu, is black the next one?
Oh, absolutely.
Oh,
and Charlie's following closely behind. But nothing stops him.
Right, I'm steering clear of your twins if they've got a grey belt in jiu-jitsu. Thank you. That is Alice raising awareness of Stickler syndrome. She's from Nazing. And Martin Snead just talking about how they're hoping that the medical profession is more aware of it.